we have Dr. Whitney Knauer joining us again, as she is a veterinarian with our University of Minnesota system. And as Kyle said, it helps with our operation there on campus. And so, Whitney, we're excited to hear some of the thoughts on animal health. And I know that you will also transition some nutrition, and from an entertainment value, you know, the nutritionist is convinced that it was the veterinarian's fault, and the veterinarian's fault is convinced it was the nutritionist's fault. But we're going to tackle this holistically. And so thank you, Dr. Whitney.
Excellent. Thanks, Travis, for that introduction. And thanks to everyone. It's exciting to see so many participants. So hopefully we can get some of your questions answered. I saw some great questions in the chat that hopefully I'll be able to address. And so our objective here really for the next, I don't know, half an hour or maybe 35 minutes is to go over the causes, risk factors, some diagnostics, treatment, and prevention of common diseases of does and ewes around the time of parturition, and then around the time of kidding or lambing, and then talk a little bit about kid and lamb disease, and then I'll also just mention vaccination at the end of this presentation. And so one thing that I just wanted to put out there, and this is something that you can Google, you can look up like first aid kit for small ruminants. I mean, get some really good lists of kind of essential things that you should have on the farm, and some maybe like nice to have things on the farm. But as far as it relates to kidding and lambing, some things we really want to think about are for sure a thermometer. That's the big and important part of your health monitoring. Of course, some sort of antiseptic or naval care solution. As it relates to pregnancy toxemia, some way to measure ketones in the blood or the urine of a sheep or a goat. Certainly as it relates to obstetrical work or our kidding and lambing procedures, gloves and lubrication, and then just gloves in general. And then here on the sides, there's a couple more things. So needles and syringes. When we think about tubing, kids and lambs having a red rubber tube and some bigger syringes there, towels, a flashlight or a pen light, some common treatments on hand, so calcium, propylene glycol, or something with propylene glycol included. We'll talk about that. And then splint material, vet wrap, maybe a halter. And certainly this is not an exhaustive list, but this is just kind of what I came up with as some important things to have in your toolbox. And then the other important thing that you need is a relationship with your veterinarian. And I know that some of you probably live in fairly remote places, and you might not be able to, you might not have a vet, at least a vet who does sheep and goat work nearby. But this is one of my favorite veterinarians. This is Dr. Emily Burrell. So she's my partner in crime at the University of Minnesota. And she's here helping a ewe lamb. And so especially as it relates to some prevention of some of the diseases that we'll be talking about, having those conversations before you have a problem is really the way to go, and doing some of those preventative things that are so important for your herd and flock health. And so just to start out, some of you are probably really familiar with the signs of a sick doe or a sick ewe, but these are kind of the ones that are important as it relates to the diseases around kidding and lambing. And so one that is a really early sign is an animal that's just slow to eat or slow to join the group. And this is a really good screening test that you can use kind of every time that you feed the herd. You can see, if someone is slow to get up or slow to come and eat. Certainly if an animal is not eating, if she's laying down and can't get up, what I call a sad appearance. So everyone knows who's had small ruminants knows what a sick animal looks like. So kind of, head down, ears down. Looks sad. Certainly a fever, so that's where a thermometer comes in. Lameness, especially, apologize for that, especially as it relates to the back legs, so weakness in the back legs. And then, an animal that is losing weight or a low body condition score. And we'll talk about body condition scoring in a little bit. And so this is one of the common things that you will find if you have pregnant sheep or goats. And it is that she is down and she will not get up. And so we're going to talk about two common diseases now that can contribute to this presentation of a sheep or a goat. And those are hypocalcemia, so that means low calcium levels in the blood, and then pregnancy toxemia or ketosis. And this is one that probably a lot of you are familiar with. This is a big topic, especially at this time of year. And this is essentially related to low energy. And really, we think about these as so-called metabolic problems or problems with the metabolism of an animal. And there's really two reasons that we have these problems in does and ewes in late pregnancy. And one is the increased energy demand from the fetus or from multiple fetuses. So when we think about energy demands and actually protein demands, especially in those last 60 days of gestation or before kidding or lambing, when we increase from a singleton, so one ewe or kid or lamb or kid to twins, we actually have a 25% increase in our energy and protein demands. And then when we go to triplets, we actually have a 40% increase from a singleton. And so that is a lot of excess energy that we need to provide to our does and our ewes. And the thing that makes it really challenging is that at the same time, we have a decreased rumen capacity. So the rumen is the big fermentation vat that sits in the abdomen of these critters and is responsible for energy and protein production. And so when you think about it, this is a really cool study that was done a really long time ago where they got ewes pregnant and then they actually euthanized them at different or sacrificed them at different stages during gestation and sectioned them and then looked to see what was actually happening in the abdomen. And so this top picture is at 88 days pregnant and a single fetus. So the red or the pink is the uterus, and then the R is the rumen, and then we've got like a kidney and some intestines in there. We don't really care about that much. What we care about is the ability of that rumen to have stuff in it or to have forage in it or grain in it. And then when we look at 143 days, which is about the end of gestation or when that animal is going to kid or lamb, you can see that the rumen is very small compared to the size of that uterus. And so that creates a real challenge for us when we think about this increased need for energy, but this decreased space to put the energy. And so that's where when we start thinking about feeding extra grain or really high quality forages, alfalfa, for example, in that late gestation or that late pregnancy time. One of my favorite studies done a very long time ago. Okay, so the getting back to the two diseases, so we'll talk about hypocalcemia or low blood calcium. And this is, if you're familiar with dairy cattle, this is something that we call milk fever. And so again, this is decreased calcium intake in this period of high calcium demand. And so this is a radiograph actually of a dog. I couldn't find any radiographs of sheep, but you can see that there are little fetuses in here. And so the kids and lambs are developing bone. And so they have this great need for calcium. And so this can happen as like a herd outbreak, but more commonly it happens as individual animals. And those again are those animals that are slow to come up to feed. Risk factors, again, late gestation. This can happen after kidding or lambing too, if an animal is producing a lot of milk. Anytime we have an abrupt change in feed or a sudden change in weather that can disrupt intakes. And then if we disrupt a feeding schedule, so maybe we're shearing and we're away from the feed bunk for a long period of time, or we transport animals, those can be risk factors too. And then what are our signs? So stiffness or weakness, and that's usually kind of a wobbly sort of animal. Eventually these animals will become recumbent, or they will lay down and not be able to get up. They can bloat, so that's what this picture is here. That's an animal that's bloated, and so that's when gas, or essentially the calcium is required for muscle contraction in the rumen. And so if the rumen is not, if the muscle contraction stops, then the animal bloats. And then eventually these animals will die. And so this is something that we can treat. And so we would want to be able to detect it and treat it. And so what's a way that you on the farm can diagnose this disease? And so typically we're basing this on the history of the animal. Maybe we know that we had a change in feed and we're concerned. And then the signs that the animal is showing us. And one way we can test this, so remember calcium again is important for that muscle contraction. And so everyone has a flashlight or a cell phone or a flashlight on their cell phone. And you can pull that out and take the sheep or the goat that you're concerned about, cover their eye up. So you create sort of a dark environment. And what should happen, you all know if you're in a dark room, your pupil should dilate, so it should get big. And then what you do, you open their eye and you flash some light in it. And what you expect is that it's going to constrict. And so this is a way, if it's slow to constrict, this is a way that we can tell that maybe calcium is the problem. And all of you, I'm sure, have more than one sheep or goat. And so if you can't tell, or you're not sure if it's slow or if it's a little slow or maybe it's normal, go check another animal. And that's a really nice way to diagnose this. And then treatment, so calcium under the skin. So again, calcium 23% borogluconate is something you can buy in 500 ml little containers. And that's a really cheap and easy way to treat this. And typically recovery is pretty rapid. The places that we would inject under the skin in a sheep, typically we're going kind of in front of the shoulder or behind the shoulder. Those are good places there. And typically sub-Q or under the skin calcium is absorbed within about 4 hours. So you can also give it IV if that's something, so in the vein, if that's something you're comfortable with, but under the skin works just as well. And then typically with treatment, if it is low calcium in the blood, they will respond pretty rapidly. But if they don't, then we kind of move on to our next diagnosis, which is probably pregnancy toxemia. So we could repeat the treatment if we wanted to. I know some producers who give the doe or the ewe a chance with some calcium, and if they don't pop back up and start eating, then they'll go in the hospital pen, or they'll get isolated and looked at more closely. And then this is just a video link to a great video from Dr. Cindy Wolf, who talks about this flashlight technique. Okay, and then how do we prevent this? So we can use our calcium to phosphorus ratio. So that should be 1.5 to 1. And that's something that, if you work with a nutritionist or you have some interest in forage analysis, you can do that. The other thing that we're going to want to avoid, again, in late gestation, we're going to want to avoid dietary changes, transportation, shearing. So here's a picture of a flock that out in the western part of the state that on shearing day, and then any other stressors. All right, so really probably the thing that is the most exciting and the most devastating when we think about diseases around kidding and lambing is pregnancy toxemia. So also known as pregnancy disease or ketosis. And this disease is related to a reduction in energy and protein intake in late gestation. And a lot of times, again, that is associated with a decreased capacity in the rumen to fill it, to store and eat nutrients. And so the sickness, or the reason we see sick animals, is because they have this disease causes very, very low levels of glucose in the blood. And one of the organs that can really only use glucose is the brain. And so kind of some of the signs, the depression, the weakness that we see sometimes is due to that. And so our risk factors here, so it sometimes can happen in early lactation. This is certainly a disease that we see in dairy cattle in early lactation. But typically in our sheep and goats, we're seeing this in the last month or so of gestation or of carrying those kids and lambs. Fat ewes are predisposed. So if our body condition is high, so 4s or 5s, what happens there is one place that fat gets stored is in the liver. And so the liver is responsible for metabolizing a lot of the glucose and making that available for the body. And so if the liver is filled with fat, it can't do its job very well. And so that can be a risk factor. And then certainly thin ewes, and really here it's just, they can't really keep up. So they can't keep up with their energy demand. They just don't have the reserves to put up with the demand of kids and lambs. Certainly multiple, so that's why I have this actually single Nubian here, but typically Nubians are a prolific breed, and so they have twins or triples, and then older ewes. Once a ewe or a doe gets a little older, they can run into more challenge with pregnancy toxemia. And so what are we watching for? So these are the signs that you will be watching your herd or your flock like a hawk during that last month, and really probably 2 weeks of gestation. So certainly, again, an animal that's slow to get up, an animal that might separate themselves from the herd. Anytime you see an animal with decreased appetite when they're late in gestation, and then the dull eyes. And then another thing to watch out for is swollen legs. So this tends to happen more in sheep, but they get edema or fluid accumulation under the skin in their legs. And they actually, in a sheep that has wool on its legs, the wool kind of sticks out straight, and the legs go from normal sheep legs to kind of like fuzzy legs. And so that would be something to watch out for. Blindness, muscle tremors, and then this is a disease that can eventually lead to death. And so how do we diagnose this? I know some of you, that was one of your questions when you signed up for this, how do I diagnose ketosis or pregnancy toxemia? So clinical signs, ketone smell. So this is not something that everyone can do, but ketones smell like, or one of the ketones that are produced smells like nail polish remover. So maybe you'll be able to smell that on the breath of your doe or your ewe. But then to definitively diagnose, we can use a urine test. So that's this keto stick here, where we get a urine sample from a doe or a ewe, and test it for ketones. It's easy to get urine from a ewe. You just hold off their nose, and typically within 30 seconds, they're going to urinate. If you hold their breath for more than 40 seconds, you should probably stop because they need to breathe, right? But that doesn't work in goats. And so another thing we can do is we can use a blood ketone meter. And this can actually be performed in a live animal, or if you have an animal that dies unexpectedly, that's something that we can do post-mortem as well. So after the animal has died. And so that's a way that we can monitor individual animals, and we can also monitor at the herd level. So we can see if we're underfeeding, or we are running a risk of developing pregnancy toxemia on a herd level. And then treatment. So there's sort of 3 principles of treatment. And one is to remove or treat the underlying problem. So maybe you have an animal who is a low on the totem pole in the social hierarchy of your herd. And she's a timid animal, and she's carrying twins, and she's just not getting up to the feed bunk because she's getting bullied. And so that would be an animal that you would want to remove from that situation, and give her the opportunity to eat unencumbered from bullies. So that's one example of removing or treating the underlying problem. And then the second is to provide an alternative energy source. So these animals cannot or are not keeping up with the energy demands of their fetuses. And so what we think about is providing that energy source. And we can use a glucose drench. We can use injectable glucose. So glucose is something, or dextrose is something that has to go IV. This is not something that you can put under the skin. It causes a big reaction, and it can also cause an infection. So that's not something we want to go under the skin. Probably a really good alternative to that is propylene glycol or glycerol. Another alternative, which is an oral treatment, is for example NutriDrench. And NutriDrench is kind of cool because it has propylene glycol in it, but it's got some minerals. It's got some other things in it. which make it kind of a nice supplement. Certainly B vitamins. So these animals, if they're not eating, they're susceptible to polio. So we would want to support the rumen with B vitamins or thiamine. And then also, this is probably a painful disease. And so considering anti-inflammatories would be, or something like a Banamine might be a good idea. And then ultimately, we need to remove the energy drain. So that can be in the form of a C-section or surgery to remove the lambs or the kids, or we can induce. So we can give steroids and prostaglandin and induce this doe or this ewe to kid or lamb. There are some pros and cons. So I think this is important for people to understand, because something that we teach students is the important thing to consider is, or ask the producer, is what's more valuable? Are the kids more, or are the lambs more valuable, or is the ewe or the doe more valuable? And that's kind of going to guide our decision a little bit. And so so for a C-section or surgery to remove those kids and lambs, so the good news is that we immediately remove that drain of energy. So we're removing those kids and lambs. It's probably the best chance of saving the dam, but we have to worry about the fetal lung. So if we're not at the right stage, or if we're not close enough to when those kids and lambs would normally have been born, their lungs might not really be up for the challenge. And then the dam, she may or may not have colostrum or milk to support those lambs or kids. So we might run into a situation where we're going to have orphans that we're going to need to feed by bottle. And then if we induce, so that means essentially giving some drugs to the doe or the ewe in order to hormonally cause her to kid or lamb. It's super cheap, so that's a plus. However, the dam might be too weak, depending on how sick she is, and she might be too weak to deliver naturally. The fetuses may not be ready, and it's not an immediate cure. So we're still going to have to wait 36 or so hours before that energy drain is removed. And the other really important thing, the reason we have these two distinguished gentlemen over here, is because we really need to know a kidding or a lambing date to make this decision in the best possible way. So that's where your marking harnesses, your hand breeding really come into play, because we can't, if we try to induce an animal who's only 130 days gestation when we're kidding or lambing 2 weeks, naturally 2 weeks later, those lambs and kids do not have a chance. So that's another really important consideration. And so when we think about prevention, so nutritional management, and so we think about feeding grain in the last month of gestation. We think about feeding high quality forages. So this is the time when we don't want to be feeding grass hay. We want to be feeding alfalfa mixes. So something that we get a little more bang for the buck when we think about energy and protein in those forages and that grain. The second thing, so Kyle mentioned this, is counting fetuses. So this is something that your veterinarian can do. Typically, we want to do this 45 to about 80 days of gestation. And what that can do is it can help you manage animals that are carrying potentially twins or triplets a little better. You can separate them, you can feed them differently, and that'll help you manage not only the nutrition, but the body condition of those animals as well, because 80 days, you're about halfway, 2/5 way through gestation at that time. So you have some time to make some changes if you need to. And then body condition scoring. So Kyle mentioned that at the University of Minnesota heard about body condition scoring 4 times a year. Certainly one time to do this, one good time to do this is at pregnancy diagnosis. And what we want, so this is a nice body condition scoring chart. And what we're doing is we're going kind of just in front of the hips to just at the start of the rib. And we're feeling, and what we're feeling for is the amount of fat that's under the skin. And what we want is the majority of our animals to be sitting right here at this 3. All right, so the next thing we're going to talk about briefly is mastitis. And so this is something that can happen post-kitting or lambing. And so the picture or the question or what you'll see is that your ewe, this sad drawing of a ewe, looks sick and her udder is abnormal. So it might be blue. Hopefully it's not blue, but it might be. All right, so crash course in mastitis. So mastitis is inflammation of the mammary gland. And it's usually caused by injury, not so much, usually bacteria or viruses, at least in our small ruminants. And so when we think about the udder or the udder half of a sheep or a goat, we think about, how does this happen? So bacteria, which are sitting like on the teat skin or out in the environment, they break down the defenses, they invade the teat sphincter, go through the teat canal, and they keep moving up, and they go into the gland cistern, and then you get an infection of the alveoli. And so if you think about kind of a forward march of the bacteria from the teat canal, from the teat all the way into the inner parts of the mammary gland. So this can be a disease which is compounded by a couple different things, and one of those things is the cleanliness of the environment. And so when we think about, so there are some viruses that are important, especially in sheep, that can cause mastitis, but the most common bacteria cultured from does, this is does with mastitis, are normal inhabitants of the skin, the respiratory tract. So that becomes important when we have this, for example, monster lamb who might have a little bit of pneumonia, nursing, or are present in the environment. So think, the straw that those teats sit in when the animal is laying down, that's a risk too. And so certainly older animals, later lactation, and large kids or increased litter size also, which would mean that you have more lambs or kids nursing and kind of interacting with the teats. And so when we think about detection, we think about clinical signs. So what are you going to look for? How are you going to detect this? So the first thing that we would look for is abnormal milk. And this is probably more common on a dairy where you're milking those animals once or twice a day, where you would actually be physically looking at the milk. And so this is milk. It came out of an udder, but you can see that looks nothing like milk. So that would be a sign that something is going on in that udder. The second is, excuse the horrible graphic here, but a hot, painful udder. So this red circle is supposed to represent redness. So you can see swelling in that udder. It's painful when you touch it a lot of the times. And going along with that, sometimes one of the first signs that you'll see, if you've got a bunch of ewes kind of in a family pen with their lambs, you might see lameness, and you might think, I should probably pick up the foot on that ewe, but you do that and there's nothing there, and then you go up the back of the ewe and you see that her udder is abnormal. And then we can also see anorexia, so the animal might not be eating, and fever. So again, that's where your thermometer comes in. And again, this can happen at any time during lactation, but probably the most common time is the weeks following kitting and lambing. And not to belabor this too much, but we're just going to go through this because these are the kind of mastitises you would see, and it certainly depends kind of on, if you're if you're a sheep person, excuse the goats up here, but if you're a meat sheep or a meat goat versus a dairy goat or a dairy sheep, but these are more specific really to situations where we have does and ewes and kids and lambs nursing. And so, acute, this would be acute mastitis or a new infection. This would be where you might see lameness. The half is hot and swollen and red. The lambs or kids might be hungry. So that might be your first sign too, that the kids are hungry and they're yelling or they're sick or because they haven't eaten in a while and they're off to the side. typically these animals are still look pretty good. And so this would be the treatment here. I'm going to talk generally about treatment because mentioning specific antibiotics or specific anti-inflammatories, that's a conversation with your veterinarian. But this is where we might use injectable antibiotics, and anti-inflammatories. And then this would be an animal that we would want to check the udder at weaning because if there's damage, we might not want to keep that animal around because if she has twins next year and she had mastitis in one half, we might not have good milk or a lot of milk in both those halves the following year. There might be some damage there. And that gets into this chronic mastitis too. Probably the second most common that you might see, especially in sheep, is this gangrenous mastitis, or it's called, maybe you've heard blue bag talked about. And this would be, it's a very serious situation, a very sick animal. And it might start as a new infection, acute mastitis, but this eventually will turn to the udder actually dying, and those animals, half of them might die without aggressive therapy. And so this again, we would consider antibiotics and anti-inflammatories, fluids. And then maybe even, this is a veterinary procedure, but removing the udder. And this certainly would not be, this is a salvage procedure, or, if this is an animal that you really love and you want to keep in your herd or flock, you might consider that. And this, is also an animal that next year might not be so successful. So this, if she survives, this might be an animal that you get rid of, or you turn her, I apologize for the jargon here, but DNB, so do not breed. So that's a dairy term, but this might be an animal that you don't breed next year. And maybe it's your favorite sheep that produces wool and you want to keep her around. And then, these last two, this is where it becomes important to palpate udders, especially at weaning, where we're trying to identify animals that may have had mastitis that we didn't detect. So, lumps and bumps are never good. And then hard bag mastitis, so that's typically associated with OPP in sheep. So, it sort of seems bleak, right? 3 out of 4 of these, we're thinking about getting rid of the animals. So again, mastitis can be a problem, but if you detect it and you treat it, you can have some success. And then prevention. So, bedding and kitting pens, mixing pens, lactating pens. If you have lactating animals, should be clean and dry, changed frequently. And that certainly depends on region, it depends on where you are, it depends on what you have available. We want to avoid overcrowding. So this picture of Sonnens, hopefully they have more room to lay down than they have to stand. Again, remember respiratory disease in kids, so that can be transmitted to the udder. And then this poor little guy, so we want to think about ORF and sore mouth in our kids and lambs. So that can be transmitted to the udder, which can predispose to mastitis. And then another time when animals are susceptible is around weaning, because if the kids or the lambs are weaned off and the animals are still producing a lot of milk, they can drip milk, and that can be a predisposing factor. And so some people restrict water. I don't think you should ever restrict water from any animal, but restricting feed can decrease, like rapid decrease in energy, can help cease or stop lactation in a lactating animal.